I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. This is Urban Health Today, and I'm speaking with Dr. Charlotte Owens, Head of Medical Affairs and Outcomes Research at Organon. She's here to talk about the societal impact of unplanned pregnancy and contraceptive deserts and the new localized program addressing this. Her plan is her power. Thanks for speaking with me today, Dr. Owens.
Thanks for having me today.
I really appreciate having you here. All right, let's get started. First off, can you explain what your office does as Head of Medical Affairs and Outcomes Research?
Sure, happy to. As the head of medical affairs and outcomes research at Organon, a global healthcare company focused on women's health, I'm responsible for the medical strategy and support of marketed and pipeline products, including outcomes research. The medical affairs team plays an important role in communicating the clinical value of our products to stakeholders throughout the healthcare ecosystem, like providers, payers, and other healthcare decision makers. And it's a two-way street. By building relationships and collaborating with external organizations throughout the healthcare community and providing their insights back to Organon, we can help ensure that our products continue to meet the needs of patients. A key part of this is really enhancing our understanding of real-world patient outcomes. And frankly, we know that most of what makes people healthy is outside of the healthcare system. So we need to understand those factors that influence a patient's care and their ability to stay healthy so that we can ensure our products meet the needs of patients and healthcare providers. Ultimately, through my work, I hope to create a more inclusive healthcare system and contribute to Organon's goal of bridging gaps in women's health, an area where attention, innovation, and investment is so badly needed.
Could you talk about the Her Plan is Her Power ESG initiative and what it means to, what it aims to achieve within local communities?
Sure. We see the high incidence of unplanned pregnancies and the disproportionate impact that it has on underserved communities as a call to action, not only for Organon, but for the entire global community to accelerate progress. That's why we launched Her Plan is Her Power. The ability to plan when and whether to start a family is one of the most important choices a woman can make. Her Plan is Her Power includes a place-based public health approach that supports community-driven solutions to reduce unplanned pregnancies. Her Plan is Her Power fuels targeted solutions in areas of high unmet need, with programs that tackle inequities ranging from large-scale global partnerships to community-led interventions. During a few of our listening tour stops, I heard firsthand some of the challenges communities are facing and how local-driven efforts can support them. I visited Plan A in Mississippi, where I met a dynamic team of patient advocates, nurse practitioners, and community health workers at their mobile clinic. They shared stories about barriers to healthcare access and health education in their community, including one example about a patient who came in with abdominal pain. And she came in to find out why was she having this abdominal pain. And she found out she was 6 months pregnant.
Oh, no.
Yes, absolutely. And so this really tells you how important access and education and really meeting people where they're at is. I was also on site at Access Health in Texas, where we heard directly from a patient who brought in her beautiful 4-week-old baby. She wanted to be there to share how Access Health saw her as a whole person, how they listened to her, how when she called, she actually got a person on the phone, and how they provided services beyond healthcare that were essential to her family, including job assistance, food pantry access, prenatal nutritional counseling, transportation, a pharmacy on site, and more. These are the reasons why we want to make sure that we're staying connected and being connected with community groups that are already in the community, understanding the needs of patients.
So, in light of the high birth rates among teens of color and the existence of contraceptive deserts, how does Organized Initiative specifically target these inequities in access to maternal and contraceptive care?
That's a great question. Pregnancy poses the greatest risk to the lives of adolescents and young girls, yet they face the greatest gaps in access to contraception and therefore risk for unplanned pregnancy. In the US, women of color face social and structural hurdles to reproductive care due to high cost, medical mistrust, lack of pharmacy access, historical inequities, and racial discrimination. The US birth rate of teens of color is roughly twice as high as that of white teens. Furthermore, there's an estimated 19 million women in the US living in contraception deserts, where there's a lack of reasonable access to the full range of contraceptive methods. At Organon, we recognize that interventions need to address the social determinants of health that affect patients before they even get to a waiting room, affect if they can get to a waiting room. And these are factors and things that we have to think about every day, including race, poverty, sexism, transportation, housing, food, and others. This further reinforces the need to focus on the whole health of a woman beyond just the physical outcomes. To overcome these barriers and increase equitable access, we need to work with partners around the globe. And in the US, we're working with partners to implement region-based community-driven solutions that ensure a comprehensive and personalized approach to meet the needs of each community where they are operating.
So, can you talk about the types of localized programming Organon is implementing? And how do these programs specifically address the unique needs of the
Sure,
respective communities they serve?
that's a great question. Organon identified partners to help drive community-oriented solutions focused on access, education, and innovation. Our initial partners include Power to Decide. When you think about the fact that 3/4 of historical Black colleges and universities, HBCUs, are in southern states where contraceptive deserts exist, this helps you understand why activating people in these communities is really important. Organon teamed up with Power to Decide to support their Beyond the Sheets campaign, which partners with 10 student ambassadors across 5 historical Black colleges and universities to empower peers through educational efforts and community organizing, spreading awareness of available campus clinic services and promoting reproduction awareness and well-being through social media content and campus events. Our second partner is Direct Relief. 4 direct relief clinics that are in contraceptive deserts support high unmet need areas were awarded $200,000 each to support a 2-year program that will increase contraceptive access, reproductive health knowledge, and equity. Organon will further expand access by donating more than 13,000 product donations per year made available to all 4,000 clinics in Direct Relief's network, totaling nearly 40,000 units through 2025.
Wow.
And over the past 2 months, we've conducted a listening tour at select community health centers and Direct Release Network to engage local community stakeholders, healthcare providers, and patients to understand firsthand barriers to contraception access and reproductive care and the community-driven interventions which can address these barriers.
What are some of the biggest challenges in reducing unplanned pregnancies and improving women's health that you've identified?
Well, I think one of the biggest challenges was understanding the factors that contribute every day to contraceptive and reproductive obstacles in particular communities, so that we could create effective, multifaceted solutions. This is why we put listening to stakeholders to understand their unique challenges at the heart of our approach to developing the program. We also recognize that this is a problem that is too big for one entity to solve. We cannot solve this alone. So we're enlisting help from the entire healthcare ecosystem, including advocates, policymakers, payers, educators, clinicians, and innovators who share in our commitment. We're excited to see that the White House is prioritizing women's health research through its initiative on women's health research. This is so important as historically investment in research in this area has been limited. The White House's commitment really aligns with Organon's vision to create a healthier every day with women, and we look forward to working together to achieve our shared goals.
What metrics or indicators are you using to measure the success and impact of the Her Plan is Her Power initiative? And do you have any success stories?
Yes, Her Plan is Her Power really builds on previous programming that we launched in 2020 through the Her Promise platform, which was designed to reach both national and global communities. Through the Her Promise and Access Initiative, we work with the Bill and Melinda Gates Foundation, the USAID organization, and many other organizations around the world to provide education, training, and access to affordable contraception options in 73 of the world's least developed countries. We're working alongside the European Parliamentary Forum for Sexual and Reproductive Rights, which created the European Contraception Policy Atlas. This has been a benchmarking tool to really track contraception access in European countries. Organon supported the expansion of this tool in select regions, and it now covers 189 countries globally. Other investments with organizations such as Women Deliver help to leverage cross-sector coalitions to empower women with sexual and reproductive information and access. And so we're able to see how we're able to kind of galvanize our efforts and really propel the impact that these organizations are seeing in the communities that they serve.
What's the age group that Her Plan, Her Power specifically speaks to?
Well, we really are leveraging our partners and the impact that they have already seen in the community. So many of these partnerships will start very early in school age children and obviously expand throughout the whole life cycle. What they are finding is that education is needed at every age. So they see that success looks different in each of these communities. So there's really no limit. What we're doing is we're empowering them to continue their work in the communities that they're serving.
What are your insights on the issues of unplanned pregnancy and lack of access to contraceptive methods impacting society at large?
Well, nearly 50% of pregnancies worldwide are unplanned. And as you can imagine, this leads to health risk and reduced educational and employment opportunities for mother and child. These are challenges that span generations. So we frequently just think of the person in front of us, but you have to think about all the generations to come. The United Nations Population Fund has stated that unintended pregnancies is a global public health crisis. While the past few decades have seen an increase in contraceptive use globally, that progress has been uneven, creating gaps and inequities when it comes to underserved community. Globally, of the 257 million who want to avoid pregnancy, almost 2/3, about 67%, are not using any contraceptive method, and an estimated 218 million women between 15 and 49 in low and middle income countries have an unmet need for modern contraception. Unintended pregnancies and a lack of access pose economic risks to global communities. Globally, it's estimated that every $1 that we spend on meeting an unmet need for family planning will yield $120 in health and economic benefit. In the US alone, the estimated direct and indirect cost can exceed $5 billion annually. And this is just the direct and indirect cost of unplanned pregnancy to the healthcare system. So we know that through grant programs and product donations and ongoing collaborations with partner health clinics, we know that our goal to close the gaps in access to contraception and reproductive care to improve outcomes is possible. We want to make sure that ultimately we create an economic opportunity for women and girls. And by doing that, we can provide them the best opportunity to reach their best selves, their healthiest selves over their lifespan.
In your view, what role does education play in reducing unplanned pregnancies and addressing contraceptive deserts? How's Organon working to improve education in these areas?
That's a wonderful question. And I want us to take a little time here. Unplanned pregnancies are largely caused by a lack of access to contraception information and services. And in many communities, patients do not have access to available resources. They may have no one or nothing to even talk to or refer back to. So, as a part of our multifaceted approach to tackling unplanned pregnancies, we're putting education very high on our list of importance. We're working to increase awareness and understanding so that women can work with healthcare providers and make informed decisions and have a safe space to ask questions that they may not feel comfortable with so that they can define and understand their own sexual and reproductive health, which includes contraception options and their best use. We feel this is so important because we know that when women are healthy, they are the backbone of a thriving, stable, and resilient society. Our hope is that when she's healthy, she's empowered, she's resilient, and she prospers, which positively impacts her community, her society, and her economy, not just for today, but for generations to come.
I know that the program is Her Plan, Her Power. It takes two to get pregnant, however. So are any of these efforts reaching young men and men as well?
You're so spot on. And that's why I want to refer back to one of our efforts is to partner with healthcare facilities that are in communities. The beautiful thing is that this care is for men and women, boys and girls. So you're absolutely right. We are trying to make sure that services are in the hands of people in the community, not just focusing on women. We firmly believe that women need to be healthy, and they can only be healthy when their whole ecosystem understands what they're going through and can support that. So absolutely, Her Plan is Her Power is not just about her personally, but it's about everyone that's in her environment.
Thank you. Are there any next steps for the initiative, like plans to expand the programming or introduce new strategies?
Sure. I think one of the things that we are really focusing on is how we can continue to listen to the community and truly understand more about what they need. We're donating $30 million in funding over the next 3 years through 2025 to really expand our collaborations, programming, and resources, really honing in on how can we combat inequities and reach community needs. So following our listening tour, we're going to continue the ongoing dialogue with our partners, Direct Relief and Power to Decide in the US, along with larger community to really apply what we heard and figure out how can we continue to contribute to community-driven, public health-based, action-driven oriented solutions.
Dr. Charlotte Owens of Organon, thank you so much. Thanks for your work with our young women and young girls. Really
Thanks,
appreciate
Ms. Thomas.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.